Good evening. Hi, everyone. Hi, my family in YouTube. This is Upstream Health with Ify again. I hope all of you are doing well and enjoying your week. So, today, okay, by now you should know that I love the human body. I love every organ of the body, and because the human body is involved in our state of mind, our mood, nobody wants pain. All right, so when one organ of the body is sick, or when we say this is not at ease, we feel very, very uncomfortable. We are not happy, no energy, you're in bed. So nobody wants to be in that state. So that's why the human body fascinates me a lot. I learn the organs, how they are connected. Remember how we talked about the gut and the weight loss video we did, and I showed you guys a picture of the gut. I showed you like from the mouth to the loop of the stomach, into the intestine, and out to the anus. So that's that's a part of a loop on its own. So today we'll be looking at another loop. So another loop that we'll be looking at is through the nose to the airways, the trachea, to the lungs, and then we'll be stopping at the heart. So from the nose connected to the lungs and then to the heart. So we'll be looking at that heart and lung relationship. Okay, and I'm gonna pick up one habit or one lifestyle habit, and I know some of us have that habit. It is called heavy smoking. So we're going to be looking at how heavy smoking can affect the heart and the lungs. So the heart and the lungs are connected. So, and also down to the kidney, but I'll be stopping down at the heart. So the lungs and the heart are connected. I'm going to be showing you guys a picture that I drew up. Very simple, not so professional. I'm not an artist, so very simple, just so that you can understand. So I'm going to turn this camera to explain to you guys what happens when we are involved in heavy smoking. What happens when not just smoking, nicotine, when we inhale pollutants long term. Remember, the effect of smoking doesn't happen in a day, it happens over time. All right, over time, I'm going to show you guys what happens to the lungs and then to the heart. Okay, and it can back up down to the kidney, but here we'll be looking more into the lungs and to the heart. Okay, so wait. Okay, guys, this is a very simple illustration of the lungs and the heart loop. So here, this is a let's say this is the right side of the body. This is the left side of the body. This is where your nose is located, right? You breathe in oxygen. Oxygen goes down here, out down here, and then this little bubbles here is where oxygen exchange happens. This is where your blood comes in to pick up oxygen. Remember when I spoke in the other video, when the kidney is done cleaning the blood, it releases blood without oxygen. Remember? So let's say this is the blood without oxygen coming from the kidney and from the other part of the body. It comes through this vessel into your heart. Then the blood without oxygen goes into the lungs. It comes right here at this area of the bubble. These bubbles are called alveoli. That is where you have the oxygen exchange. So the blood comes here and picks up oxygen. It travels out of the lungs back to the left side of your heart here. And then it goes from your heart back round down to the body to feed all the organs. And when it's done feeding all the organs, it travels back, picks up waste back to the kidney, and then round the kidney will bring it back. The kidney and the other vessels here brings it up back here. All right. So now what happens in the lungs of those who are heavy smokers. So I just want you guys to pay attention and learn, so that when you have some habits that are harming you, you'll be able to stop, ponder, and know what actually you're doing to your body, what you're putting in through your mouth or what you're inhaling. All right. So heavy smokers over time, all right, or people who inhale pollutants in the air, depending on where you are. So what happens over time is this airways gets damaged. This alveoli, which is your lifesaver, actually where you have oxygen exchange going on, gets damaged. It gets damaged, you don't have enough, which means you don't have enough surface area for gas exchange. So what happens? So you're going to see that person having shortness of breath. The person can take 10 steps and get very tired and want to rest. And you also know that our body is able to produce mucus to protect us from outside pollutants also. So over time, the cells that produce mucus for you gets increased. So you see people over time who are heavy smokers or where the lungs are being damaged, you find that they are producing more excessive mucus over time. So the mucus is going to lodge here, and that's why you find that in individuals with who have lung issues begin to have pneumonia, infections, and over time also you can see lung cancer. So heavy smoking, it's what I'm trying to emphasize here. I don't want to talk about asthma or other issues with the lungs, because heavy smoking is a modifiable lifestyle habit. So that's why I want to talk about that, so that if you are watching this, you can make decisions or begin to plan. All right. Or when you pick up that stick and put in your mouth, you will see what you're doing to the body or to the lungs over time. Like I said, heavy smokers over time, this is what happens. So this airways get destroyed. This alveoli or your lifesaver bubbles get destroyed over time. You are having excess mucus here. You are at high risk to infections. Okay, and over time, like I said, one of the complications, now this is where you're going to see where the lungs and the heart connect. So over time, when this area of the heart of the lungs becomes destroyed, you see, I told you here, the blood is supposed to be flowing this way, right? Over time, when this gets destroyed, instead of the blood flowing this way, it begins to back up. So over time, as I was saying, when this bubbles gets damaged, right? Or the airways gets damaged because of nicotine, air pollutants in the lungs, over time, this gets damaged. You see the blood here is supposed to flow in this way, this direction, and back to the heart. So over time, if this is damaged, the blood comes into the lungs and finds out that it doesn't have this air bubbles. There is no surface area to pick up oxygen. And this also because it gets damaged, right? The little blood vessels here also gets damaged. So that way there is leakage. There's what we call leakage, right? Leakage. And the fluid, the blood will begin to back into the heart. So at the time when this is damaged, we have what is called, I'll make it simple, lung hypertension. Yeah, we have lung hypertension in those who have damaged lungs, right? And then the fluid backs up into the heart. We have what? Right-sided heart failure. So when the lungs gets damaged, it can lead to right-side heart failure. All right. So with this right-sided heart failure, the fluid will also back up down to the body. You see the legs are swollen. The kidney becomes malfunctional. So I just wanted people to see the loop involved, that whatever happens to the lung can affect the heart. So our focus here is the habit of heavy smoking, how heavy smoking can affect the lungs and also affect the heart and also affect some other parts of the body. All right, this is not trying to raise, I'm not trying to raise up a scare, but to help us to be aware of what happens when we have a behavior that is harmful to our health. So if you know someone who have this behavior. Okay, so that simple illustration or picture was just to show us how some of our behaviors or unhealthy behaviors upstream can affect our quality of life in the future. So when we put stuff in our mouth, we should be knowledgeable of what that food or whatever it is that we put into the mouth or through the nose, what impact does it have on my health? It might not be short term, it could be long term. Like heavy smokers, it's a long term effect. Like I showed you in that picture, over time your lifesavers, which is the alveoli or where the air exchange happens, gets destroyed. So in that individual who is a heavy smoker, over time you don't have enough of your lifesavers. So you see yourself getting tired at every little work. Or maybe you take you run, you can run a long distance or even walk a long distance. And also you find that you're coughing more, you're producing more mucus, and you're at risk for infection like pneumonia. You're at risk for bronchitis. You're at risk for emphysema, what we call COPD, asthma. So all that puts you at risk for a poor quality life. So on the other side of this, if you already have breathing issues or lung issues, or you haven't gotten yourself tested, you should follow up with your primary care provider, especially if you've been smoking for a very long time. All right, to get your lungs tested, scan your lungs, because heavy smoking over time can lead to lung cancer also. Okay, so this is just to create awareness, not to be judgmental or to raise up a scare, but for you to stop, like take a pause and say, let me do a check of myself. This is a habit, I know it's bad. Even though I enjoy it, the reward is only very short. Okay guys, so I'm gonna round it up here, and then if you have any questions, always go back to my Instagram and ask me questions over there. And please don't forget to like, comment, share, and click on the button, the notification button, so that you will get an alert when I upload another video. And please, if you haven't subscribed, please make sure you subscribe so that you can be part of this family. Like I said, we're gonna do great on this channel. This is just the beginning, okay? And we are still setting up. All right, see you guys in another video. Bye bye.